Hello, my name is Zubeida Ramji, and I'm a PhD candidate at University of Ottawa School of Nursing. I'm also the Executive Director of Care Center for International Educated Nurses, which is an organization fully dedicated to supporting international educated nurses on their journey towards registration in Ontario, Canada. I have been a student at University of Ottawa for the last 2 years, and I've been working under the supervision of Dr. Josephine Itola. My area of interest, which is linked to my daytime work, is to look at integration of international educated nurses in the workplace. And I have reviewed the literature and gone through the early stages of my PhD journey, and at this point I have come up with a conceptual framework, which is the focus of this presentation. So I hope this is going to be interesting and that it makes sense. So just to begin with, I wanted to do a quick review on the significance and the relevance of looking at um, really anything to do with international educated nurses. And many of you are aware that international educated nurses, or I'm going to refer to them now as IENs, are quite a significant segment of the nursing workforce in Canada, but also various other Western Hemisphere countries. And they do incur many costs at a very personal, social, emotional, and of course economic level. And similarly, there are costs incurred by governments and employers as well when they recruit and when they put in supports to help IENs transition. Um, IENs are seen as making an important contribution, both from the point of view of addressing current as well as future shortages of nurses in Canada. And the Canadian Nurses Association has also acknowledged that international educated nurses also reflect the increasing diversity of the patient population in Canada. And so they are a very important way of changing the face of nursing, if you will, in Canada. Ibitayo and Shu and Kropp have studies that demonstrate that IENs are a stable segment of nursing workforce, and that really warrants um, the system to invest further in their ongoing um, satisfaction of staying in nursing, and hopefully staying in nursing and progressing in nursing over the long term. So, in terms of the problem, I guess when I reviewed the literature, these were kind of the three main revelations, if you will, for me. And first most is that there has been quite a bit researched and written about IENs in the last decade or so. I would say maybe, I think going back about maybe even up to 15 years. And the term integration has been used in the literature. It's part of titles of publications. It's used quite readily. But what is quite interesting is that integration is not being defined, and so that's the first concern. And within the context of the workplace, it's also not being really talked about very much, uh, especially beyond the early transition or orientation phase. So there's a lot of studies that are focused on the challenges that IENs have in the early phase, not just migrating to the new country that they're entering, but also the registration process, and then finding employment and transitioning into the workplace. There's quite a bit that's been documented in the literature. But what seems to be missing is that there is no definition, and also looking at IENs in the long term in terms of how they're progressing or their experience beyond that early adaptation, orientation, whatever you want to call it, transition phase. Beyond that, there hasn't been much attention given. So when you look at the literature and you look at it from a critical perspective, which is what I have done, um, there is a concern that the literature right now, or most of the attention, is really one-sided. And Raghuram in UK in 2007 talks about this, and she talks about how the focus in the literature and the research seems to be exclusively what IENs need to do to cope and adapt to the host environment. And there hasn't been really much focus on, um, you know, opportunities that IENs have around influencing the rest of us, the host environment, in terms of how we think about nursing models, nursing practice. That it's very much, how is it that IENs can fit into our systems. And there are, specific definitions that, like in the Ontario context, for instance, um, there is an attempt to relate the IEN experience to the new grad experience, and a definition that is present in the literature around integration of new grads is again focused very much on having them achieve independent practice and adapt to the culture of the organization. And in making the connection to new grads, the implication or here by these researchers out of McMaster University, Bowman and Hansberger and Priya Arsenio, they are suggesting that again, how is it that IENs can be supported to achieve this type of autonomy in their practice and really adapt to the organization. There hasn't been much acknowledgement that the employer may have a very specific role and that the organizational context has a big influence on the experience of the IEN in terms of their journey to getting integrated, if you will. And that Adams and Kennedy have talked about how the approach to IEN integration have have really been uncoordinated. They've been somewhat ad hoc, and organizations or employers are not really taking systematic or broad-based approaches to looking at um, how the organization has to also make adjustments to to create an environment where IENs are able to effectively um, integrate. And so, from a critical perspective, this is a gap. My concern is that the heavy focus on the challenges that IENs experience, which really have to do with that fairly exclusive focus on the early transition phase. That, along with not having a definition and not having any emphasis on the role of the employer and how the organizational environment has a bearing on the experience of IENs, that those things combined really kind of problematize the IEN. And from my point of view, that is a big concern that we ought to be addressing in nursing. When I looked at the literature, and again, because of my background, I do have an extensive history in terms of working with organizations that supported immigrants and refugees in their settlement process. And so I had been somewhat familiar with the immigrant and refugee studies literature, but I took the opportunity to dive into that in a more deliberate kind of a way because when I made the observation about the nursing literature, I thought, okay, well, let's see what other people are talking about when they talk about integration. And of course, the immigrant and refugee literature is much more generic, and it talks about integration of immigrants and refugees at a societal level. But nevertheless, I think that given that there is this gap in nursing, we have an opportunity to look at what the current knowledge about integration is from the immigrant and refugee studies literature. So there are several definitions, but what is interesting is that all of the definitions kind of um, congregate around some key ideas. And the key ideas are that integration is both a process and a goal, that it has to be thought about as a two-way mutual process, which is, dynamic, it has many facets, and it's not something that is short-term or that there's a start or finish date to it, that it's an ongoing process. That what this means is that not only does the immigrant and refugee has to be willing to adapt to the host environment, but that uh, the the community has to also be willing to change in order to be welcoming and responsive to the needs of immigrants and refugees that could be quite diverse. And so, what there is in turn then an emphasis on is that programs or organizations that are trying to support or work with immigrants and refugees really need to work hard at being inclusive. That when you are inclusive in your approach, that increases the level of acceptance that all of us have of immigrants and refugees, of really acceptance of difference, that immigrants and refugees have a greater sense of belonging and they feel more valued and more recognized. And that these are some very important prerequisites to increasing their participation, in a fuller way, in a more equal way. And when that happens, that immigrants and refugees can actually start making some very concrete gains in what's referred to as um, four domains of life. And these are the social, cultural, political, and economic domains. This work was this thinking has been contributed significantly by the Canadian Council of Refugees and the United Nations High Commission of Refugees as well. So, based on this work that it exists and this thinking that exists in the immigrant and refugee studies literature, and given that in nursing we have not really come up with a definition around integration and also specifically workplace integration, what I am proposing is this, that we draw on the thinking from the immigrant and refugees literature, and that we and this slide really speaks about a proposed definition. And I'm proposing that we think about workplace integration of IENs as a long-term and complex two-way process with outcomes that are achieved both at the individual as well as the organizational level. That the context of the workplace as being a systematic, organization-wide um, commitment to diversity and inclusion at all levels. This allows for full and equal participation for IENs, which then results in specific achievements in the economic, social, cultural, and political domains of their nursing work life. So again, it's a bit of a long definition, but what I think is important is to capture all of these notions about workplace integration being a mutual process and as a two-way process. So this is something that I'm proposing, and it is, definitely drawing, as you can see, from the work that you find in immigrant and refugees studies literature. Now, when you take this to the next step and say, okay, so what does this actually mean in terms of organizations and IENs? The next couple of slides speak to that. So the definition basically uh, then points to that, IENs who are integrated in their workplace would have equal opportunities for career advancement and mobility. So that would be their, the economic sphere of their nursing work life. That they experience fair and equal treatment by colleagues, by managers, by patients and their families, and this would be the social aspect, and from a cultural aspect, that they are valued and encouraged to share models of nursing, for instance, from their other reference points, from their former practice environments. IENs come with a wealth of experience, and they come from experiences that are quite diverse, and so that they would feel valued and encouraged to share that. And when they do that, we are actually opening ourselves up to allow them to influence us in how we think about nursing and nursing practice and nursing models. So that's how, in a concrete way, it could translate in terms of this definition. So when you think about the definition as a central kind of component, or as a central piece of our conceptual framework for workplace integration, um, the next slide has a schematic, but before we get there, we basically, um, in this framework, I am proposing that when there is an inclusive and diverse work environment that recognizes more than one view of the world, and that the culture in the organization is such that there is an ongoing signaling of the importance of learning from differences, that there isn't just one dominant view of the world, and that in an organization where there is vision and commitment at the senior levels to create an inclusive organization, that then there is a deliberate process of change that is facilitated, which is systematic and organization wide. What happens is that we start seeing some very specific outcomes that are really integration, and integration that is two-way, both in terms of outcomes at the organizational level as well as the individual level. So this schematic here now is the conceptual framework, and basically it puts in a graphic way what I have just been speaking about. But just to kind of reiterate, um, the vision and commitment is absolutely key at the senior level. Senior champions have to really drive the process. And when they do that, it becomes kind of a contagious type of a thing where there is broad-based buy-in in wanting to build an inclusive organization in all aspects. And this kind of leadership then has to be passionate, and it has to really drive the change. It brings people on board and has people working in teams. And there's very much from a cultural point of view, an organizational culture that is participative and that really values the various, perspectives that might exist about any given issue or any given problem that people are jointly trying to solve. And this, culture is also one that celebrates, differences, and it celebrates successes that point to changes that point to changes that really are a part of the goals around becoming more inclusive. The organization is led in a way that, from a management point of view, it's a very strategic management process that there is deliberate allocation of resources where there is recognition that this is going to be a long-term process, that if deliberate resources are not earmarked, that really sends the wrong signal to the organization around the commitment, and that a change process to become more inclusive does require very a very much a concerted organization-wide effort to look at all of the systems and structures in your organization and ensure that changes are made so that there aren't barriers, whether they are covert barriers or overt barriers to people from different backgrounds. So there is very much a commitment in terms of allocation of resources and communication about the process, about the intent, about the vision, about problem solving, sharing successes, sharing experiences, best practices. There are multiple ways in which communication is open, two-way, or multiple way, or multi-way, I guess, and that people are encouraged to participate and also to persevere, because this is a kind of change that doesn't happen overnight, that it is an ongoing process. It actually never ends, and that there is always, pushing the bar further up, and that's something that there is some joint accountability here that is recognized. So when you, what I've been describing is really aspects of a process that works towards building an inclusive environment. And when you do that, there are achievements at the organizational level, and achievements that really point to various practices that are more fair, more equitable, and that value the worth of everyone, and really allow for participation, for full and equal participation by everyone. So that's what you would see, and that's what you would experience as a change at the organization end of the two-way integration process. On the IEN end of the process, or IEN end of the two-way integration, at the individual level, IENs are um, experiencing some specific achievements in terms of their social, cultural, economic, and political domains of their work life. And just to elaborate on that a little bit more, um, what this conceptual framework does then is that it shifts the focus to beyond the early transition phase that the literature seems to be um, heavily concentrated with, that it puts the emphasis on the employer's role and responsibility. It really shifts the emphasis and um, acknowledges that you know there is a major influence of the workplace context on how IENs experience the workplace and the extent to which they're able to integrate in those four domains of their life, and that integration then is seen also as an outcome that is not just focused on IENs, which would then, you know, um, really reiterate that whole idea about what IENs have to do to fit, but in fact also the outcomes are at the organizational level as well. And so there is an interest here to monitor and track outcomes at both ends of the two-way integration uh, concept. When we talk about the specific achievements that IENs would experience and the four domains, what I have here is again a way to kind of differentiate the four domains, but also what is seen as a shorter term uh, goal for the transition phase, but what as opposed to what might be a longer term integration goal. And um, so what you see here is that the the, the dark font are really the goals in the short term. So in the short term, on the social level, um, internationally educated nurses are, you know, trying to build a diverse social network, but in the long term, for workplace integration, there is you know a greater capacity uh, on their part to be able to access and influence the workplace. That on the cultural side, they have gone beyond adapting to nursing in our context, and they have really started examining or have redefined, if you will, their own nursing identity and values, and that they are not shy about sharing what those are, and that is part of their capacity to also influence us, which if we go across to the political sphere, that on the political side, um, at the initial stages when they're getting oriented and transitioned into our context, there's more of a focus on becoming more aware about how how change comes about, how decisions are made, what are the mechanisms or structures to facilitate that. But in the longer term integration phase, they are actively participating in those structures and those mechanisms, and they're influencing nursing within their teams, within their units, within their organizations by more fully participating and sharing their perspectives and being heard, of course. Then just to finish off the circle here on the bottom right side, of course, is the economic sphere, and this by far is what is top of mind for most people, most international educated nurses, especially in the early stages where they're focused on getting a job and becoming financially independent, because they may have been drawing on supports from their social network, their family network, and they've been working on really getting here and getting that job and becoming in nursing and becoming self-sufficient. But in the longer term integration phase, then the focus is much more on progressing and advancing and becoming more mobile from a career point of view, where expecting income equality is something that is a natural expectation, and that there are opportunities that are coming their way to advance in nursing. On the organization side, the achievements are, as I mentioned earlier, um, becoming, the achievements on the organization side are really kind of evidence of having become an inclusive organization. And this is a chart that lists what might be thought of as attributes of an inclusive organization. So a lot of this I have already referred to earlier. This is a list that's been generated by a project at Cornell University, and their work is quite extensive, where they've actually taken each one of these attributes and teased it out into specific policies and practices that an organization might undertake to achieve inclusion, where one of these specific attributes would be demonstrated. So, as I wrap up, what are the implications here? From my perspective, I think the implications for nursing are that when we think about this broader way of visualizing workplace integration of IENs, that the two-way notion is a much more balanced notion. It really is a much more healthier notion. And it is by no means, as I said earlier, this thinking is not shared, it's not evident in the nursing literature. So it, of course, requires validation by IENs themselves, but also other stakeholders within nursing and in healthcare. And that is something that I'm going to be venturing to do in my research. Another implication here for this conceptual framework is that it really points to the notion that organizational systems and structures may have a dominant view of the world and dominant kind of culture that dictates how things are done, how decisions are made in the organization, and that really the implication of this conceptual framework, which really emphasizes the importance of an inclusive environment, organizations can't be stuck in their one way of doing things. The other implication is that organizations may have done all kinds of recruitment where people from diverse backgrounds are involved. Um, However, if the culture is not an inclusive culture, then basically what we're doing is we've invited people to be part of our organization. They bring different, a wealth of diverse backgrounds and experiences, but really we are having them adapt strictly to our way of viewing the world, and that is not integration in the Canadian context. That really is assimilation, and we would need to be thinking about this philosophically and conceptually in a very deliberate kind of a way. When inclusive organizations allow for fuller and equal participation, of course, the implication is that IENs are more empowered, they have a greater sense of belonging, feeling accepted, recognized, and valued. And that really increases the potential for their involvement and for their achievements in the four domains that we talked about, and that really is indicative of their integration, and that this conceptual framework proposes that that inclusive environment would allow for maximization of achievement in those four domains for the IENs themselves as well. So in final remarks, in my conclusion, I guess, when you think about creating an inclusive organization, inclusive environment, which is, as I mentioned, such a centerpiece of this conceptual framework, this kind of change, what it does is that it, of course, benefits the IENs, but in fact, it benefits the organization as a whole. All nurses in the workplace benefit, and because and all other workers also benefit, because what you start doing is where various groups might be experiencing marginalization uh, from a specific vantage point, from a specific social identity that they have, whether it's being disabled, whether it's their sexual orientation, or their the way they speak English, whatever it might be in terms of what might be allowing or creating marginalization for them. That really, when you become inclusive, you benefit everyone and the organization as a whole. And what this does is really create dynamic and high functioning teams where everyone is valued, everyone's skill sets are used, and you're tapping into um, the talent pool, the entire talent pool that you have in your organization. And of course, from a nursing point of view, what that ought to do is really result in culturally competent quality care for diverse patient groups. Um, this isn't something that Adams and Kennedy have uh, acknowledged and talked about, but the research in this area is still, a bit scarce. But from a logical point of view, that's what you would expect, is that the quality of care would be um, much improved, and especially for people from diverse backgrounds. And overall, what this does then is create greater capacity for IENs to have a broader influence, not just within their workplace. Of course, that is something that is kind of a priority focus in for workplaces, is for them to engage and fully involve IENs. But with that kind of achievement within the workplace, IENs um, could have the capacity to have a broader influence beyond the workplace in the broader nursing profession, in the broader healthcare system. So that's concludes my presentation. I have on the next two slides references that I've used to further my, and I would be interested in hearing from any of you with your comments or questions. This is definitely a work in progress for us, and any kind of dialogue would definitely help our thinking evolve further. So if you would like to be in touch, this last slide has the contact information for myself and Dr. Josephine Tola. Thank you very much.